Welcome to the Healthy Futures module in the CNCS Performance Measure series. This module is designed to provide a general overview of the Healthy Futures focus area and where the Corporation for National and Community Service will be focusing its national service investments and measurements. In this brief overview, we will introduce Healthy Futures as it relates to CNCS and why it was chosen as one of the focus areas for national service programs. We will also introduce the agency-wide priority measures and the grantee and sponsor measures for Healthy Futures. CNCS will focus on demonstrating the potential for CNCS-supported national service interventions to address health needs within communities. These interventions address independent living and aging in place, access to food resources, childhood obesity prevention, and access to health care. Activities will increase the ability of homebound people, seniors, and persons with disabilities to remain in their own homes for as long as possible, improve people's access to food and other resources to increase food security, increase children's physical activity and improve their nutrition to prevent obesity, and improve people's access to primary and preventive health care. The CNCS Board of Directors has identified Healthy Futures as a strategic priority. Our focus is on enhancing and adding value to what already exists in communities, working in partnership with state service commissions, local government, nonprofits, and faith-based organizations. Right now, hundreds of national service programs are committed to helping communities to improve the quality of life for seniors and others living on their own, provide better access to health care and food resources, and fight childhood obesity. This work includes a range of activities such as home care services, programs for people with physical disabilities, health and nutrition services and education, food distribution and collection, health screenings, immunization, and substance abuse programs. Coordination and planning with local and federal partners is a high priority. CNCS will work with the U.S. Department of Veteran Affairs, the National Institute on Aging, Center for Disease Control, and the U.S. Department of Health and Human Services, among many others. This collaboration helps to mobilize people and improve the capacity of local communities to respond to these important issues. And now, let's look at why. The statistics of those in need are staggering. For example, according to the U.S. Census Bureau, by the year 2030, there will be almost 72 million Americans over the age of 65. That number is more than twice what it was in 2000 and represents only 20% of the entire projected U.S. population in 2030. The challenge this will bring to the country is unprecedented. Right now, in New York alone, there are about 6,500 seniors in nursing homes who could be living independently if they had access to some basic services. Access to food is a key concern for low-income populations and programs that serve them. Although food-related assistance is available, not all people who are eligible are receiving it. For example, in 2008, the national participation rate among individuals and households eligible for the Supplemental Nutrition Assistance Program, or SNAP, formerly the Food Stamp Program, was only 67% for individuals and 64% for households. Children's health is a primary concern. More than 16% in the U.S. are now obese, almost 1 in 5. Since 1980, obesity rates for children have tripled. In fact, obesity rates among all groups in society, irrespective of age, sex, ethnicity, socioeconomic status, education level, or geographic region, have increased. People who need health care are not receiving it. An alarmingly high proportion, 59%, of uninsured adults who had a chronic illness such as diabetes or asthma did not fill a prescription or skip their medications because they could not afford them. These issues impact all Americans, and every day volunteers help to provide health services and programs to people in need, whether it be a senior who needs a little extra help to remain in her home, a family at risk of hunger or in need of preventive health services, or a child at risk of obesity. CNCS is focusing on Healthy Futures because the U.S. health system is under enormous stress. This is partially due to the epidemic proportions of Americans who are obese, as well as to the inequality of access to health care. For example, people without insurance often forego preventive care due to the cost, and when they are sick, they turn to emergency rooms for care. Another reason to focus on healthy futures is that the infrastructure is there. Many government agencies at all levels, as well as nonprofits and faith-based organizations, provide assistance. CNCS has developed strong relationships with many of these organizations. National Service can support and build on the work these agencies and organizations are doing. And last, National Service programs are uniquely positioned to provide this care. CNCS-supported programs have provided critical support to millions of Americans affected by health issues like long-term hunger, access to care, and obesity, and quality of life issues that affect health, such as the ability to remain living independently at home as you get older. CNCS has identified 2 agency-wide priority measures to tell the national service story on the work we do in the focus area of healthy futures. Numerous studies have found social relationships have effects on physical and mental health. For example, a recent national survey of older adults conducted for AARP found that loneliness was a strong predictor of poor health. Individuals who have a fulfilling social life, however, tend to be healthier and therefore more capable of living independently. Studies on nursing home entry also found that individuals with stronger social networks, that is, social support, and social activities have a lower risk of institutionalization. For these reasons, CNCS has set an agency-wide priority measure to determine the percent of homebound or older adults and people with disabilities that increase social ties or social support with the help of a national service program. The corporation is interested in investing in programs that provide services to homebound or older adults and individuals with disabilities. These services include providing food, transportation, or other help, such as companionship, that allow them to live independently. Grantees and sponsors providing independent living services will be asked to track the number of homebound individuals who are receiving these services and the number who reported having increased social ties or perceived social support. The second agency-wide priority measure under our focus area, Healthy Futures, looks at the individuals that have gained access to food resources provided with the assistance of CNCS-supported members, participants, or volunteers. As noted earlier, many people who qualify for food assistance do not receive it. The USDA reports that in 2008, almost 15% of households were food insecure. That is, they did not always have access to enough food for a healthy life. This includes almost 6% of households with very low food security, which means the food intake of one or more household members was reduced and their eating patterns were disrupted at times during the year because the household lacked money and other resources for food. CNCS is interested in investing in programs which provide individuals with emergency food and other support, services, education, and/or referrals to alleviate long-term hunger and increase food security. Grantees and sponsors will be asked to track the number of people receiving emergency food from food banks, pantries, or other nonprofit organizations, the number of people receiving support, services, education, or referrals to alleviate long-term hunger, the number of people that report increased food security for themselves and their children. CNCS-supported national service programs aim to build on local communities' efforts to improve the healthy futures of all Americans. Thanks for your interest in healthy futures, in CNCS, and in service as a solution. For more information, please contact us at www.nationalservice.gov. We appreciate your interest in national service.